Hey, everybody. Welcome back to Communal Expressions. I'm Eva Melton. We're here today to do a perspective on COVID-19 from a mental health perspective, and I'm here with my co-host, Richard Rice. Richard, how are you today?
I'm doing well, Eva. How are you?
I'm doing good. I'm doing good. And so today we have with us two mental health professionals, one from Alabama and one from Virginia. And so we have Mechelle Frazier from Work in Progress Counseling and James Harris from Men to Heal in Richmond, Virginia. So what we're going to do, Mechelle, I'm going to ask you to introduce yourself to our listeners.
Okay, I'm Mechelle Frazier. I am a licensed professional counselor, and I work for Work in Progress. I do individual, couples, family counseling, from 4 or 5 years old all the way up to adults. I was born in Detroit, Michigan, but I've been here, and obviously by the way I speak, you can tell I've been here my whole life. So been in Alabama since I was about 1 year old. So I consider myself native.
Sweet. And then James is from Virginia, Men to Heal. James, if you want to take a moment and introduce yourself to our listeners.
Yeah. I'm James Harris. I'm an entrepreneur. Then I turned therapist so I can give back and have positive representation in the field. I'm looked at as a unicorn by a couple of different people just because there's not a lot of African-American therapists. So that pushed me to create the movement Men to Heal, which you just recognized, which is focused on men's overall wellness. I'm fortunate enough to do seminars all over the country via Skype, unless they, fly me out. So it's a lot. And I just actually published a book, which is this right here, which is an interactive guide for men to better express themselves. So it's called Man, Just Express Yourself. And it it's different exercises in there to assist men with opening up. We're talking about feelings, emotions, detachment, displacement, just a couple different things for men to open up.
That's awesome. I love to, number one, meet Black male therapists. And a lot of times I look in some of the conversations or the webinars that I've been seeing, that voice has been left out. And so that was why I was particularly looking to target and to reach out to you. So I'm glad that you joined us. But so my first question, I'm going to pivot to Mechelle. During COVID-19, I know things have been different. You guys have had to shelter in place, not necessarily be in the same physical space with a client. How have you guys had to adjust? What are you guys doing to adjust to meet the needs of our community?
It's been a big adjustment. We've had to shut down our physical offices. So we've switched over completely for right now, while we're on this lockdown, to telemental health. So we provide services via, if you're not comfortable with your face being shown, we do it over the phone, or the way that we are all chatting here now, we do it in this mode, face-to-face video. We use a service, we make sure it's HIPAA compliant. You have to have a password to get in. So we still try our best to maintain that confidentiality. So it's been requiring us to be creative, even in how we get paperwork to people, how they get it back to us, and even doing therapy this way is very different. So it's a learning curve. We're learning as we go, but we've been able to still kind of meet clients and see clients and give them help.
Awesome. Have you found, with an existing client, I could see it easier to come on and say, hey, let me jump on and talk to my therapist over this Zoom. But what about those that are in a position where they know they need to talk to a mental health professional, and my first interaction with you is going to be over Zoom? Have you found that being a barrier during this time?
Surprisingly, it hasn't been. And I think it's because you've got people kind of cooped up and they're so ready to talk by the time that they make that phone call to get the help. They're able to, with some help, kind of get past that. I think by the time you pick up that phone to call, you're really willing to try anything at that point.
Understood, understood. Now, James, has it been the same for you, or have you found it to be a barrier, especially when it comes to like interacting with Black men, Zoom, that you have never talked to them before?
No, I've been fortunate. Like I still got my current clients. I haven't taken on any new cases since the pandemic. Everybody I had at least 1 or 2 sessions with them prior to everything being shut down. The only challenges I've run into thus far is my younger clients, around that 7 to 12 age, they're still restless. So just sitting in front of a screen for that hour is not as pleasant as it could be, just because they want to get up, they want to walk around, they want to do different stuff. Because normally in session, I have different things, different objects I can give them to not be as restless. And then with my older clients, like couples, for one, that are older, that is not as tech savvy, they have a little bit of issues. But outside of that, it's been pretty good, pretty consistent. And to echo Mechelle, it's pretty much like, I just need to talk to somebody. I'm glad you're at least available. So with HIPAA relaxing the regulations, we pretty much can do phone conversations as well as like Zoom, or I think on some of them you can even do Google Hangouts. So it's been a journey for them to still allow people to be seen during this time.
I would
Wow.
piggyback off
Wow.
of that. Yeah. You do have to be creative with your younger clients. When I was seeing them face to face, I can incorporate like activities or games. You really can't do that this way. So you have to find a way to incorporate that in, whether we join in on a game together, or I share my screen to show them something, or we do some kind of thing to discuss emotions. We've had to get really creative with our younger clients.
Yeah.
Yeah, yeah. Awesome, awesome. I'm glad to hear that the industry, the regulations have been laxed so that you guys can get, people can get the help that they need. But one of the questions I have is, do you see any topics that are coming up from African Americans that you feel may be somewhat concerning our community? Meaning the topic that's coming up in your sessions may be particular because that person is African American.
I've had to reassure a lot of different people to not only, so pretty much people think now like, okay, everything's shut down, I'm supposed to take this time and create a masterpiece. I've been reassuring people to, hey, listen, this is also a time for you to rest. You've been working 2 jobs, going home, taking care of the kids. Like, use this time also to catch up on the rest that you haven't get. Try yoga, try deep breathing, mindfulness, and meditation. Somebody is going to create a masterpiece and somebody's going to catch on rest. And both of you guys are correct. Don't feel that you have to be overwhelmed and tire yourself out, because everything is shut down or whatever the case is. So continue to develop yourself, work inward to outward, find your balance and catch up on things that you wouldn't normally do in this downtime. So some of the things too that you're probably seeing on TV or the news or the media is African Americans dying at a higher rate. So, we process that through our therapy, just letting them, I let my clients know, like, you can only control what you can control. So let's focus on the aspects of things that you can control. Take this time, if that is the case, take this time to change your diet, research better eating habits, exercises and different stuff like that, opposed to using this time to dwell on something that you have no control over.
Wow, wow. What about you, Mechelle?
I'm seeing a lot of increase in anxiety and fear, and for us as African Americans, it's tied to like a grind or hustle culture. You have men and women who serve so many roles of husband, wife, mother, father, caretakers, workers, managers, business owners, where I was able to use some of those things to mask or stay busy. Now that I don't have some of those things, the anxiety and those negative thoughts are starting to creep in. So we've been having to process that you've got this time and now you're just sitting here with your thoughts and you're having to actually face what it is that is an issue for you outside of those things. The other thing I'm seeing is like a spiritual or faith issue. I have some people who, am I guilty because I believe in God or my higher power, whatever that is? But at the same time, I'm still worried. I don't want to die. I don't want to lose any family or friends. So just trying to find that balance in their belief system, seeing a lot of anxiety, depression, that kind of thing picking up.
Well, yeah, definitely. I think that's a good summary of kind of just what we are seeing even play out on social media. It's almost like you get an opportunity to, to see a summation of what most people are thinking just by monitoring social media and obviously seeing different reports on the news. But there is this general sense of just with the uncertainty, there's anxiety. And so many folks are used to working and being able to have predictability in their life. And some of that's being taken away right now. And I think it can be used in a positive way, as you said, but it's this idea of, being anxious about any situation, like what general, information, or is there a specific practice that you give to your patients in terms of, addressing anxiety and like breaking it down and saying exactly this is what, when you're experiencing anxiety, this is essentially where you are and this is how you can cope and work through it. And that question is to both of you.
Okay. I know it sounds odd, but I tell my clients to schedule worry time. So some people already have this naturally where, I can't do anything about it now. I'll worry about that later. So then they come back to it. Some people don't automatically have that. So what you do is you schedule that time. That's that time where you allow yourself to think about those things that are troubling you. You could journal, you could write out how you're feeling. Once that time is up, you move on to something else, and take your mind off of that. So that way you're not allowing your thoughts to cycle through all day, every day, day after day after day. Another thing is putting that thought on trial. Your perception is one thing, but then you ask yourself, you kind of go through the evidence. What's the likelihood of this happening? It's rare. You reason it out, and then you decide, okay, the chances of this happening is slim. I know what precautions I need to take. I know what I need to do to keep myself or my family healthy. I'm just going to follow these guidelines, and then I'll work on what I can control, as my colleague said, and then I'll put the rest aside for later to be concerned about.
Yeah, so I pretty much do something similar, but I definitely try to, we run through the what ifs. So what if it happened? What if it doesn't happen? So again, you can control what you control. And then this right here is a pandemic that's worldwide. So it's not specifically targeting you, so that right there alleviates some of the worry from the individual, like, oh yeah, it can happen to anybody, not just me. So from there, we try to work on just identifying different triggers that'll get you anxious or upset, or just how you having those worried thoughts. So we process those through, all right, write me a list of 5 things that could go wrong. Write me a list of 5 things that can go right. And then we process those things. All right, 3 of the 5 things you just mentioned has nothing to do with you. So, you know what I mean? Like, why would this thought continue to bother you? And then after they look at it that way, they be like, oh, you're right. I don't even got to worry about this because I don't have a cure, or I'm not, my family's not over there, or whatever the case is. So they start finding their own remedies to situations, and then that takes back the worry. So journaling or writing is definitely therapeutic for some people to, because they can always go back to it later. Like you wrote something 2-3 days ago, you can flip back through and see, like, all right, cool, I already thought about this. I don't need to think about that no more. So it's not as intense as it was 2 or 3 days ago when you first wrote it.
Right. That's really helpful. Those are some practical tips, and I think any of us can, utilize those today. If that's something that you can take home with you and begin to put into practice right away, even if you're not directly going in and meeting with the therapist. And so, my next question is a little bit related to some of the work that I do as a public interest attorney and handling civil rights cases. And a lot of times we'll see situations in which African Americans in particular are disproportionately affected by police brutality. We've seen that African Americans have been disproportionately impacted by COVID-19, coronavirus, and so many statistical categories were overrepresented in terms of having a negative impact in those situations. And so I think that could lead to a certain level of trauma, or just kind of lead to maybe affecting one's view of self. And I think the African American community, we do a great job of being able to see humor in situations, and so I think that's definitely a good tool. But beyond that, what are some of the things that that you all would recommend in those situations, or what are your general thoughts on how we process these types of situations as a community?
Well, yeah, like you said, though, we are typically disenfranchised the most out of each ethnicity, I think. I mean, you can argue that Native Americans and different stuff like that, but of course, African Americans are definitely in the top of being disenfranchised or displaced in certain things. And this COVID is shedding the light on a lot of different things, such as medical conditions, food insecurities, and stuff like that. So unresolved trauma has been in our community for years. And what I mean by unresolved is trauma itself has become normalized to where this young man or this young woman has seen things, and now they're not as bothered as, I guess, a Caucasian or Asian or somebody would after they've seen the same event. We start to normalize seeing different things. So when we hear or see on the news that something like these mass load of people has died, we start, I guess, trying to out trauma each other in the effect of, well, I seen somebody die when I was 12, so that, like, we started rationalizing, like, oh, well, I guess it's normal. So that effects can play on the mindset of young people as well as old people.
I think you need to consider too, like, yes, as Black people, we are more disproportionately affected, but then ask yourself, why is that? And is it because of diets or health or things like that? Well, if you look at the South, there are a lot of people with certain conditions due to their diet or their health. But ask yourself, what's the difference, say, in like access to healthcare? So if I look like me and I go to the doctor and I tell you I have these symptoms, I'm hearing more people say, well, I got turned away. They wouldn't test me. So ask yourself, why is that? And am I being caught as early as others? Am I being treated or tested as early as others? And then once you kind of look at why are these things happening, you can be more strategic in how you move. And I guess it depends on where you live. Well, okay, if I'm not being heard by this doctor, I can maybe find a doctor that looks like me that may be more considerate of my complaints or whatever my healthcare issues are. I think because it's easy to get caught up in statistics and what the news, that's a whole nother story. What's being presented as if now we're the face of this disease, which is interesting to me. If it's something that affects everyone, why are we more so succumbing to it than others? What's different between us and other people? Well, what's their access to these resources and what's ours? So I think you have to look a little deeper sometimes at things like that.
If you want to add to the fact of the lower SES, the access, the availability of these healthcare centers, the pre-existing conditions, with the asthma, lower SES communities tend to have more lead within the homes because they use different kinds of paint and toxins and stuff like that, or they built around areas with, swamps and factories and stuff like that.
Yes.
So it's affecting the immune system as well as the respiratory system. So I believe that's why the rate of deaths are impacting us more because, our body can't take it. We already filled with different toxins and, different things just based on environmental reasons. And then you add on this respiratory virus, it's hurting people. That's why the ventilators, I think, are so important. But who got access to them if they're not delivering them to certain areas or placing priority on these certain areas? So that to me can contribute to those factors, as well as add to that stress of man, here we go again, not being able to have the same amount of access and availability on different stuff.
Right. Yeah. I mean, I think you covered it from every angle, and that's exactly, what I was, intending to ask is, the virus itself, the pandemic has really exposed, which a lot of these things were evident, especially if you're in a certain line of work, or you pay attention to certain types of things. A lot of these issues were exposed, but it certainly has highlighted them and made it even more undeniable that these issues of systemic racism. You brought up some issues like environmental racism in terms of where we live and where our neighborhoods are located. And we talked about lack of access to healthcare, and how our diets may be impacted based on the socioeconomic status as well. And so I'm curious about, when you see these type of conditions and this type of situation perpetuating, how often is it impacting us individually or as a community, in which you understand that this situation is created before you. It's not about you individually, but in terms of folks limiting their own individual aspirations or the aspirations of a community because of this pattern that is, almost absolute. But, I don't know if there's an answer to that question or not, but I do think it's a question that we should ask, because if we're not aware of it, then I think, it's affecting us subconsciously, even if we're not talking about it. And so many of us, we may get into a battle who can be, the strongest, or who has, had the toughest life, who grew up in the roughest community, and brag about that and boast about it. But my experience tells me that that's not really that core individual's personality. That's not really consistent with their greatest level of humanity. So I'd just be curious to know what we can do collectively to have space for us to be able to talk about these things, so that we can, heal and go out and be our best selves.
Well, so I mean, within proximity, I think it is their environment, like you just mentioned. I guess they was comparing their traumas pretty much, but that's all some people have, though, to be real with you, is to compare or out trauma the next person based on their proximity, because around certain neighborhoods, that's what they see. But I think, me personally, I try to advocate for much organizations or causes that are within my community that I can. I mean, I haven't ridden on a public transportation bus in probably 15 years or so, but if it's a public transportation meeting going down at City Hall, I'm there just to advocate, because I know it's this old lady that's gonna have to walk 3 blocks now, or this young kid gonna have to, get off the school bus and hurry up and get home before it's too dark, just based on that fact. So it might not affect me personally, but I know that my clientele, I know that, my family members or people within the community can benefit from a voice like mine, or somebody to articulate certain things to people in charge. So for me, advocacy is important, not only from a clientele perspective, but just from somebody that might be able to persuade somebody more effectively than you can.
Mhm. I think another aspect too is kind of like, if we had nothing else, we had each other, so we could kind of like pool resources or pull together and have discussions and come up with ways that we can kind of intervene and help in our own community. So if I know this barbershop or this beauty salon was the center of our community, and they've had to close our doors due to circumstances, well, the ones of us that are fortunate to still keep our jobs, maybe we can do some things. Maybe we can purchase or advertise for, prepay for services. And then as soon as we open up, it's back to business. Or just how can we come together and pool our resources? If there is an initiative, if there is a instance in the community where we're dealing with generational trauma, which it can be passed on, then maybe there's always health fairs. Maybe there's a mental health table. Maybe we could offer our services, or, speak on something, and this is something out of your heart where you're not necessarily charging a fee for it, just a way to give back to the community, a way to help each other out.
Awesome. Yeah, that's both very good responses. And so one of the things I have been thinking about after interacting with some folks in my spiritual family that have lost family in other states. Like right now in Detroit is a hot spot. But they are in survival mode themselves. They're trying to survive, but they're losing people that are close to them. And so they cannot go to the funeral because number one, it's not wise to do so. They could not be there with them, as they were dying. Is there such thing or some type of terminology around delayed grief where people are trying to survive, but they're not really processing that they are losing people? Are y'all seeing this?
Yeah, I actually lost my aunt and my cousin last week to COVID-19. And I think you on my Instagram, so you probably seen my video, The Stages of Grief. So I put that up now while I was grieving, but I know it can potentially help other people. So I pretty much break down the 5 stages of grief, what they are and how they can impact you. So I definitely think it can be a delayed response, because ordinarily people try to avoid it or try to cover it up by, taking on extra shifts at work or just doing other tasks around the house. But if you don't process through those stages of grief, it can impact you in a way or at a time that you're not really prepared for. So I would suggest you taking the time out to actually just, get it out. And again, that can be on your timing, but if you want to understand or process the stages of grief or just know what I'm talking about, definitely go to my IG and it's on there. So I'm sure you'll probably put the links up to our social media and stuff like that, but it's on there.
I would
What you got,
agree.
Mechelle?
In addition to like the stages of grief, there's also something like the 4 tasks of mourning. The first task is to be able to accept the reality of the loss. Well, if I wasn't allowed to the bedside of my loved one because of fear of being infected, or if I'm the type of person I have to see them laid to rest or put into the ground, funerals and services are changed. I live out of state. If I can't travel to see my loved one, maybe it's not reality for me. So there becomes tension there. There becomes a problem that develops for me. So it very much can be interrupted. And until I can get to that place, or maybe there are other family members who are still battling coronavirus. So I don't get the chance to mourn like I want to because I'm still worried about the other ones who are battling it themselves. It can very much hit you at a later time once you get that downtime to kind of process it. So I would agree and it may be something where you develop your own ritual. If I can't go to the funeral or speak words, I may have to celebrate that person's life in a different way. It's calling for us to rethink things, think outside of the box on how to process our feelings, which a lot of times we don't. As Black people, we tough it out. We're hard. We soldier on. We keep pushing. Sometimes we need to just sit down and feel what we feel, not just anger or not just happiness. It's okay to be sad too. It doesn't make you weak.
Yeah, you definitely got to process those feelings. And I also want to mention that no grief, like the process for me might be different than yours. So there's no such thing as he's not crying or she's not crying. They didn't care as much. Like that, there's no way that you can prove that, So I would definitely say process in your way, but definitely sure that you're processing in a healthy way.
Right. Those are great responses. And, this question is something you all have touched on already, but, there is sometimes a stigma about receiving or going in to seek therapy, talk to a counselor, and in particular in African-American community. And then it seems to me, I don't know about the statistics, that even men are more reluctant to go in and receive counseling. So what are those primary issues? I think maybe if we talk about the issues, then maybe they'll make it easier for folks to address them. But what do you think it is? I mean, the stigma is a general way to say it, but I mean, we don't have the same apprehension about seeking treatment for any other aspect of our health. So what do you all see as the primary issues for that?
For me, yeah, you're right on point, man. For men, the numbers are staggering, not only for mental health, but it's physical health as well. That's 2 to 3 times likely not to get a physical every year when women are typically getting a physical, every 6 months or whatever the case is. So I did an article with a magazine maybe a year or two ago, and that's on my website. But I highlight some of the issues that identified that men highlighted that they identify with the reasons why they don't seek help. So from the older generation perspective, they related to the Tuskegee experiment. They was injected with syphilis, basically. So they tend not to want to go to the doctor just for the simple fact of, are you treating me? Are you curing me? Or are you giving me something else that's going to make me sick? Or am I your guinea pig? And to be real with you, you can see that now. I think it was a week or two ago, the French or somebody said they wanted to go to Africa and test out the COVID drugs and stuff like that. So just imagine that older guy, like, see, this is why, you know what I mean? So for him, it's justifying the reasons why he didn't want to go. And then you got, of course, the ego, like, I'm not going to the doctor until some bleed or fall off. That was some of the responses that most men say. They can tough it out, they can deal with it, because like mental health is different from physical health. Like if my knee hurting, I can lift up my pants leg and I can see, oh, I got a bruise there. That's why it's hurting. But it's nothing right now that we can identify to open our minds up and see that our mind or our heart is aching. So it's a little bit different. It's not as tangible or not readily accessible to say, yo, hey, you got a lot on your mind. I can't identify that by looking at you. I can only assume by the body language or, like how you're displaying your presentation to me. And then we look at the fact of just plain and simple, like my family depending on me. I can't take off work or I don't have insurance to take off work to go to the doctor or sit in this session. I got to put food on the table. I got to do certain things for my family, or I'm going to appear weak. So some men tend to equate vulnerability with weakness. So of course, to sit in front of me and express yourself or to display a certain emotion, it's going to look like you're soft or something. I don't know how many times I can count on my hand where I had somebody that was, 6'5", 250 pounds, like, yo, I'm not depressed. That's a female diagnosis. Well, based on these symptoms, bro, you're depressed, and there's nothing wrong with that. So I find myself re-educating men, especially on symptom management and what actual diagnoses are. So people, of course, think that diagnoses can be gender-based, like depression, lack of interest or pleasure, not eating, not sleeping, isolating, not hanging out with people. Like, that's textbook depression. But, you, this big tough guy that play football, you looking at it like, oh, no, only females get depressed. They lay around and cry, so that's just the total opposite.
I know for me, and even asking some of my clients, past experiences play a part in it, and just lack of knowledge. For one, if you're concerned or you think it's something that's very expensive, and in some instances therapy can be expensive for some people. Also, if you've been to healthcare, whether it's a doctor or another therapist, and they weren't culturally competent, because each culture does things differently. So if you don't understand my culture, you're putting a pathology on me. If I tell you that, my grandmother came to me in a dream, to somebody else that may be weird. To somebody who was of the same culture to you, it may not. They may understand exactly what you're saying, how you're saying it, without you having to go in and educate and explain, well, this is what we do and this is what we mean. There's already a lot of times that understanding there. So when you come in, you're not made to feel like an other or different or deficient. You have something that's causing you a problem. You tell me what your goals are. We talk, we come up with a treatment plan to work together. I'm incorporating your belief system into it. I'm incorporating your culture into it. I'm incorporating your personality into it. So if I came up with this thing for you that I thought was great and it doesn't resonate with you, you're not going to listen to me. You're not going to want to do the suggestions I suggest because it doesn't fit you and who you are. So a lot of times when Black people go to therapy, you know, you're talked at, you're talked to, you're talked down to. Nobody wants to hear that. Nobody wants to experience that. So when you come in and you have someone that understands you, then that's different. So I think a lot of times we don't go because we don't want to be judged. We don't want to be looked at as other. And sometimes we get that. I've experienced it myself, so I know it's not a good feeling.
Yeah, I've experienced that too, Mechelle. And I think at one point I really knew that I had to have a Black therapist because I felt like I was spending my sessions just trying to explain background that had nothing to do with what I really needed to talk about. So, yeah. Well, I appreciate both of you all joining us today. So before we go, I wanted to just see if any of you had closing thoughts that you wanted to tell our listeners about, or even how to contact you. But if you have some closing thoughts, this would be a great time to do it. Mechelle, you can go first.
I do. When we talked about things changing in your life, I kind of thought about the things that are shut down, whether it's school or work, was kind of a refuge to get away from problems at home. So if there's domestic violence or child abuse going on, I just wanted to leave some phone numbers that the listeners can call if they need help. It's some national hotlines, and they can put them in touch with agencies in their local area. So the first one is the National Domestic Hotline, and that number is 1-800-799-7233, or you can text 22522 and they'll text you back. The other one is the Child Help National Abuse Hotline, and that's 1-800-422-4453, or you can call 1-800-4-A-CHILD, because those incidences are increasing as well.
Awesome. James, did you have anything?
Yeah. To add to your numbers and your hotlines and stuff like that, if you're looking for a therapist that suits you or at least close to you can go to Psychology Today, and they have profiles up of different therapists, so you can pick through one that you feel closely related to. Also, don't forget that coping is a process. It's not going to happen overnight, but just make the necessary steps to get to a place to where you feel that you're healing. Also, be sure to go to my website. The book is available for pre-order. And also go to my Instagram so you can watch that Stages of Grief video in case you need it or somebody else will need it. Eva, are you going to put up our handles, or should I just mention it?
You
can mention it now, but I'll definitely put them up.
Okay. Yeah. So the website is men2heal.com. men2heal.com. Instagram is men_TO_heal. Just hit me up if you got any questions. If I can't answer it, I definitely assist you in getting resources or somebody within your area if I can.
Okay. We are able to be reached at workinprogresscounseling.com. We're Work in Progress LLC on Facebook, and on Twitter and Instagram, we're WIP Counseling. If you need a therapist in the area of Birmingham, Tuscaloosa, Northport, Coleman, I'm even licensed in New Jersey for telehealth. You can call 205-993-4563. I think that's all of them. We also have a YouTube channel, so you can look us up there and subscribe. My supervisor, Cherie Edwards, is a wonderful therapist, and she did a couch talk with tips and things that you can do to help you cope during this time.
That's awesome. Awesome. Richard, you want to tell us how they can find you?
Yeah, sure. You can find me at resultswithrichard.com, or you can find me at thericefirmllc.com.
Richard's also on Instagram, so you guys should go find him. He's under Richard_A_Rice or results with Richard, and I'm under Unleashed with Eva. But I've appreciated this discussion. To everybody, once we have this edited and ready to go, it will be on communalexpressions.com. We'll live it on Facebook as well as on YouTube, and we'll also put it on some snippets on Instagram. So hopefully you all will share this and link it up on your websites just to get the information out, and hoping we can do this again, because I'm finding, number one, the Black experience is sometimes being left out of mainstream media. And number two, the Black male experience and the Black male counselor experience is being left out of discussions. And so that is standing out to me. And I think both of those voices are very important if we're going to pull through as a community. So I thank you all, and y'all have a great evening.
I appreciate it. Well, nice to meet you guys.
Nice to meet you too.
Nice to meet you too.